Hello and welcome to Inside Kurdistan Extra. Joining me today is Dr. Muhabat Daloye, Head of the Obstetrics and Gynecology Department at Suleimani Medical School. Welcome to the show.
Thank you very much.
Dr. Muhabat, you have lived abroad and you've now living in the Kurdistan region in Suleimani. Can you tell me how you would evaluate the health system here, in particular in Suleimani?
Okay, actually you cannot compare the health system here with something like a United Kingdom health system, because they have established and systematic health system there. And then now here I feel too much improvement here. When I returned back by year 2005, there was lots of problem, and now year by year getting better and better. But still we need to work hard until going to reach that system abroad.
What would you say the main problems are with the health system here in Kurdistan? Why is it not established enough?
Lots of, it's a multifactorial actually. It is it is not a system. There is no system for health system out here. There is no guidelines in the hospitals. There is I can't say there is no professionality, but it's not comparing to there is no, it is a professionality, it is less, especially with the staff nurses, with the medical staffs. Doctors, they are improving themselves, they are going to courses. I have seen lots of them, they are going, you know, on their expenses, going abroad and then training themselves and coming back. But in Britain, for example, the health system forcing them to have this, and then they pay for them to have to up-to-date themselves. And medical staffs, the governments are trying to improve them, but unfortunately, for whatever reason, they are not at the level of that the medical staffs or nurses working abroad. And the hospitals, obviously, they're getting much better, more cleaner, more organized. I'm working in maternity hospital in Suleimani. Comparing 2005, I can say 200% improved. By many ways, it is beds, organizations, more department, and more organized, more systematic, and they are trying to put the guidelines for the hospital. But still, you got lots of problem. It is a doctor's problem, nurse problem, patient's problem. Patients, they are not aware what they want, what they need, and where to go when they have a problem. Like one day, they can visit lots of doctors, hospitals, wasting this resource of the hospital on the doctors. And the problem also, it is the mixed service, it is the government service and the private one. And then I'm working for government at the morning, and then afternoon I'm working for my private clinic. And then there could be some bias, because maybe there is something, it is, you cannot go work at the same time, at the same day in two places. Right. For me, I'm working in 4 places. Government, it's a hospital, and afternoon my private clinic. At my lunchtime, I'm going to do private surgeries, and then at the same time I'm teaching and then working for the university. This is multitasks. It is letting you to not going to be more productive.
There's lots of criticism that there are doctors like yourself who take on 4 jobs, 3 jobs, and do it during the day, so there's multiple tasks, like you said.
Yes.
They would suggest that maybe you should just take on 1 or 2, because the more jobs you do at one time will affect the quality of service that you provide your patients.
That's very right, because I have seen lots of, few persons in this country, they are taking too much responsibility. They do not let anyone to take, they are not sharing this responsibility with others. So if I'm doing 4 jobs at the same time, obviously I'm not going to be very good. So I have to share this responsibility with others. I'm not going to be the head of the department at the same time responsible for the Kurdish board, responsible for Arabic board, responsible for diploma. I cannot do it. We are, as a human being, we have some capability, and then beyond this, we cannot do.
Would you consider reducing the number of jobs that you have at the moment?
At the moment, I have to do it because when I'm working in the university, I have to teach my student at the hospital. So I have to work for the hospital. I have to have a patient to teach my student on them. And then at the same time, when I'm doing my private clinic, and this is because the another problem is that financially the doctors they cannot live on government salary. So that's why I have to open my private clinic. And my private clinic is equal to private operation also. So my patients, they do not like to come to the hospital. They want privacy, they want more care, more service. So that's why they're asking for private. So I cannot stop. So I have to do all of them.
There's also another criticism in regards to the quality offered by public hospitals versus private hospitals, and that is about the financial gain for the doctors involved. Would you say that this is a valid criticism? If you have a private clinic, you're in it to gain more financial benefit, so your quality is raised, whereas if you work in a public hospital, you don't give as good quality because the wages, like you said, are just not sufficient.
I cannot say that because if I'm working in my private clinic, this is you're telling me that if I work in private clinic, I care too much to my patients because they are paying me, and then in the hospital, no. Not me, all the doctors, they are not doing this at all. But the time in the hospital, it is limited, and resources limited, and everything's limited. So that's why I'm spending too much time with my patients in my clinic, because at the morning time they are booking 100 patients in once for one doctor, and then in my private clinic I am controlling the numbers of patients. So I'm going to see limited numbers, so that's why I can't care like I caring about them. It's too much. It's much better than the hospital one, because if I'm sitting, for example, in Ali Kamal clinic at the morning, this is not my choice. They are booking as much as they can coming to that clinic, and most of them, they are not coming because they are sick, because that is a very cheap service. They are paying, it's like it's nothing, just nothing. They're getting too much service, and then most of them, they do not need it. But when they are coming to the private clinic, they are really sick. They are really, they want to come to and see the doctors. Yeah. What
can be done to regulate these things? Like, for example, a clinic taking on 100 patients a day, because obviously quality will be very downhill. If you're, one doctor is seeing 100 patients a day, that's obviously too much. Is it on the Ministry of Health to regulate things like this as well?
Yes. They have to have a system. The system is that if the doctor working for the hospital should work for the hospital only, and those working for their private clinic, they have to work for their private clinic only. Because if I am working from 8 o'clock until 5 o'clock regularly in the hospital, and then so I have a continuity of care of my patients, because once per month I have a clinic in the hospital, so I cannot have a continuity of care. So my patient is going tomorrow to another doctor and another doctor, so that's why the patients are going to the private clinic again. So if I don't have a private clinic, and then regularly I'm sitting in the hospital and then working in the hospital, my patients coming back to me to the hospital, and then going to good service, and then less wasting of the government money, less wasting of the patient's time, and then the patients also, there is some kind of the loss of trust with the hospitals, because they think they are getting those services without any payment, or a very little amount of payment. They feel that this cheap service maybe is not good, so that's why they are going to the private clinic, and then if they pay more, they feel that they're getting too much care.
Do you think that's the case?
In my opinion, yes, because just yesterday I had a case. I decided to do an operation, taking the womb out for her in the hospital. I booked her on my list, and then she called me that I'm going to Hindustan because they said it's much better. I said, I'm doing this operation for you. It is without any payment. I'm doing it for yours by myself, and then everything's going to be all right. It's a clean hospital, it's a nice hospital. They said no. I was told I have to go to the Hindustan because Hindustan is much better, India is much better than here. So they're paying, and then because they feel that this service in the hospital, cheap service, it is not good.
That seems to be a big problem here, that patients seek treatment abroad because they feel the services provided or the medical care in Kurdistan is not up to a good quality. What would you say to people who seek treatment abroad? I mean, do you yourself feel that the medical treatment offered in Kurdistan is good?
In my opinion, yes. As good as India's one. We've got lots of good doctors, trained doctors, and our hospitals also, they are very good. And then lots of facilities, CT scan, MRI, good laboratory, good everything's good. So I think they are paying for nothing. I'm not advising them to go abroad at all. If there is something it is not available here, yes, that's fine. But it is a routinely, daily, in the maternity hospital in Suleimania, lots of the hysterectomy will be done. So how come she's going for a simple hysterectomy to India?
Okay. If a relative from your family wanted to seek treatment abroad, but we had the same treatment here in Kurdistan, would you discourage them from going abroad?
Actually, be honest, it is the problem is not with the availability of the drugs or beds or the X-ray or something like that. The problem is here is mostly the communication problem. It is the patients, they are getting everything, but not sympathy, but not nice words, but not good communication, but no explanation, no information. We are, as a doctor here, we are doing very little about communication, giving information to our patients, explanation, and then spending too much time with them. And then if we have a good communication here, lots of patients, we can persuade lots of our patients to stay here and not going abroad. And my family members also, I'm treating them here like anyone else. Okay. They have a facility because most of them is living abroad, so they can get benefit from the service also there.
Okay. One of the other problems with the public hospitals seems to be the lack of patient confidentiality and the lack of a systematic appointment schedule. How would you combat things like that?
In some point, yes, I will agree with you. Yes, patient confidentiality here is not as a good level because we have a mixed wards, and we have if you are going to tell a patient, so if, for example, at the morning clinic, outpatient clinic, if 5 patients come into the room, 5 together, so how can you keep their confidentiality and privacy? And I can't. And then in the hospitals we don't have patient's confidentiality, patient consultation, communication. We have to have a private room. We have to have lots of doctors working at the same time, because daily in all hospitals in Suleimania, in all Kurdistan, Iraq also, they are appointing one doctor for one outpatient, and others they are free. They are not doing nothing. Some of them is going to theater room and then labor ward and this. But according to this good number of doctors, we are not working daily. It's like I worked in Britain, and then the hospital, it was a general hospital, all outpatients clinic, they were open at morning, at evening, different specialty, and then no doctors without job at all. Daily they have a duty to do. But here, because they are putting a lot of working and the duty on one doctor per day, if they are dividing this load on the doctors, so instead of seeing 100 patients daily, if I'm working with another 5 doctors, 5 rooms, sitting in 5 rooms, we are dividing this number to 5. So that's, in this case, 20 patients, I can protect their confidentiality, I can speak with them in privacy and explaining more, spending too much time with them.
Why don't the other doctors try to implement a system like this, or do they have to wait for the Ministry of Health to regulate these, pass laws? and regulations before this can happen? I mean, I'm sure all the doctors know that there is a certain oath that they need to uphold, and patient confidentiality is just one of them. Why don't they start to implement it in their own practices or even in the hospitals that they're working in?
Because there is a lack of space and time. We don't have too much space. As I said, only one room in the, for example, Ali Kamal, or in the maternity hospital, you got one room to see a patient. But if you have outpatients like 10 rooms, and then obviously if I'm working for the government all the time, so I can spend too much time. So you don't have enough time to spend with our patients. And obviously if I'm seeing 3 or 4 or 5 patients together, so I cannot protect their confidentiality.
So is the main problem space?
Space, time, training. And then you have to believe in the system that you have to protect your patient's confidentiality. You feel that sometimes the patients also, I'm asking them, please don't come in 2 or 3 together. They said, we are happy. I said, are you happy to listen to someone else listen to your problem and your secret? They said, yes, I'm happy. So it is not only doctors, the patients sometimes they are quite happy. And then seems to be the culture.
There's also seems to be another culture in regards to patients and medicine. They feel if they go to a doctor and they don't receive medicine for whatever their ailment may be, a doctor hasn't treated them properly.
That's right.
How do we change this culture that, you know, you need to have pills to get better, which you don't?
Yes. If this is also coming back to the first point, if you are speaking to your patient and then explanation, consultation, most of my patients going out in my private clinic or at any time without any medication. Because you have to, but when you are going to ask them what you have and then writing down the medication for them, obviously, and then they like adapt it on this system and then say doctors is equal to the drugs and medications. So you know, medications means that she or he doesn't know anything. But if you are speaking to them, explaining to them, and then most of the medical problems, you can solve it only by just talking to your patient. That's it.
There seems to be, more often they say that the equipment in the public hospitals are of very good quality. Sometimes the problem is the maintenance of these equipment. Is that the case? And do we have enough qualified, trained doctors who know how to use these equipment to utilize them to their best?
In my opinion, those equipment and those things, when they are buying it, there are 2 problems. Sometimes those people they're going to buy those, for example, for maternity hospital, they are not asking us to go and buy it, and then they're asking someone which is not specialist in that one. This is one thing. Another thing is that they are looking for something maybe cheap, and they are paying too much money, but this money is going somewhere else. But it is the government paying money, but this money is not going to that equipment. And because it is like an agreement between the buyers and those things. I don't know. This is one thing. Another thing is that any new equipment to the hospital, any instrument, anything, they should have an agreement for training and maintenance. They should have it. And then the time when, by the time, for example, they are buying an equipment or something for the hospital, before this hospital ready to take this equipment, and then this agreement for maintenance, for example, 1 year, and this hospital is still not open. They bought it last year or 2 years ago. So this guarantee for 1 year's maintenance is gone. And then you have lots of very expensive equipment in the hospitals. We cannot use them. We cannot use them. So that's why we have to pay, and then training, and then keeping those tabs on those equipments. When they have a training, they can operate them, and then after a few months, they're going to move them, that staff, that trained staff, to another department, and leaving this equipment without trained staff. So this is the continuity of working in the same department is very, very important.
If we move a little the focus onto the women's health issues in the Kurdistan region, there's been lots of discussion of late, the main focus being on pregnancies, prenatal care. Is there enough information for young women, especially young newlyweds who've just gotten married, about pregnancy, birth control, and prenatal care?
There is a service called antenatal classes.
Okay.
So every hospital should have it. It means that the patients, not the patients, pregnant lady, come in with their husband. This is very, very awareness of the partner, of the husband, about pregnancy, about problem, about how to care about the pregnant lady and to care about the newborn baby. Mm-hmm. It is important to the husband also has an information. Unfortunately, we don't have this service here. But there is a clinic called preconception clinic, only just going to look for the genetic or inherited diseases in the family, and then before marriage, they're going to that clinic, they're going to test them for like a common disease here, like a thalassemia or other inherited disease, and they're going to tell them that if you, for example, both of them is a minor thalassemia, they're going to tell them their chance to have a thalassemia major baby, and checking their blood groups, and then yes, there is, but it is should be much better, especially antenatal classes.
Okay.
It is now proven it is reducing the rate of cesarean section, and then husband's awareness is very important, and less family problem with this clinics.
Another thing that seems to be on the rise is breast cancer in the Kurdistan region. How have the doctors combated this? What has been done? Are there screening tests? Can women come and do screening tests just to see?
Unfortunately, we don't have a regular system calling back like Britain. They're calling every woman from age 20 to age 60 for cervical screening and for the breast cancer screening. Obviously, breast cancer screening is after 50 years old, and then if they have a strong family history, they're going to call them a bit earlier. But cervical cancer screening, it is not available in this country, but we have this service in maternity hospital.
And just finally, what are your recommendations for a better health system in Kurdistan?
My recommendation is that it should be systematic and should be electronized. And then we need too much hospitals. Now, fortunately, this Shar hospitals opened, but we are expecting many hospitals now. It's another obstetric hospital. Also, it is on its way to be finished. But this city is getting bigger and bigger, so the population is getting also larger. So that's why we need lots of hospitals. Now, this service at the moment, it is not enough. It's not enough. So if you have lots of hospitals, obviously the building is not enough. We need a trained staff. Training is very, very important. Professionality is very important. And then the system of the, like a government one and private one should be separated. And everyone should feel responsibility and then working for the sake of the patients. And then another thing is that the patient's awareness is very, very important. And the patients also, they have to be educated. And now I can see, comparing to the previous years, the media is now helping. It's very helping. And the patients now, my patients, they are coming, taking out information from internet and discussing with me. And then I feel that there's some improvement in patients' education also, in the health system also. But still we need more improvement, more professionality, more systematically, and then obviously keeping patients' records also is very important, because this is the main problem, that our patients, we don't know what happened to them. And then because they are not keeping their records, so that's why they are going to the wasting government resources by doing lots of investigations, could be repetitive. Yes.
All right. Thank you so much for joining us. It's been a
Thank
pleasure.
you. Always pleasure. Thank you very much.
Thank you for watching. It's another issue of Inside Kurdistan Extra. Goodbye.